When it comes to managing diabetes, most people focus solely on limiting carbohydrates, taking medication, or monitoring blood sugar levels, overlooking a crucial element: vitamins and minerals. These are not merely micronutrients, they are powerful helpers that improve insulin sensitivity, protect the nervous system, and prevent dangerous diabetes complications. According to the World Health Organization, WHO, up to 85% of type 2 diabetes patients are deficient in at least one essential vitamin or mineral. This deficiency not only makes blood sugar control more difficult but also increases the risk of complications, from nerve damage and cardiovascular problems to vision impairment. As a healthcare professional, I've observed that adequate vitamin and mineral supplementation can help diabetics manage their condition more effectively, reducing their reliance on medication. However, not everyone understands which vitamins are truly necessary or how to supplement effectively without causing side effects. Therefore, in this video, I will introduce the 3 most essential vitamins that diabetics are commonly deficient in, along with how to obtain them from natural foods and supplements to optimize health. Don't miss the next section, as this information could help you control your blood sugar more effectively. Fire. Vitamin D is not just the vitamin of bones, but also considered a sunshine hormone, with a vital role in regulating insulin function and reducing chronic inflammation, 2 key factors in diabetes management. Why are diabetics prone to vitamin D deficiency? Insulin resistance and chronic inflammation. In diabetics, insulin resistance combined with high levels of inflammation hinders the body's metabolism and utilization of vitamin D. High blood sugar and frequent urination. When blood sugar is poorly controlled, the body tends to lose vitamin D through urine, reducing the amount available for essential functions. Lack of sun exposure. Many people with office lifestyles or living in polluted areas limit their time outdoors, leading to decreased natural vitamin D synthesis through the skin. Age. Studies show that older adults have a reduced ability to metabolize vitamin D due to declining liver and pancreatic function, increasing the risk of deficiency. A study published in the journal Diabetes Care indicated that over 60% of type 2 diabetes patients in developed countries have vitamin D levels lower than recommended, contributing to the increased risk of disease complications. Signs of vitamin D deficiency. Patients deficient in vitamin D often experience fatigue, muscle pain, bone pain. These symptoms often appear subtly but persistently, reducing quality of life. Slow wound healing and increased risk of infection. Vitamin D loss can impair recovery and weaken the immune system. Numbness, memory impairment. These are warning signs concerning the nervous system, potentially leading to serious complications like nerve damage. Impact on reproduction. In men, vitamin D deficiency can lead to reduced testosterone and sperm quality. In women, it can cause ovulation disorders and difficulty conceiving. The role of vitamin D in the body. As a healthcare professional, I believe that vitamin D plays a key role in improving insulin sensitivity. Vitamin D stimulates receptors in pancreatic beta cells, enhancing insulin production and secretion effectively, reducing inflammation and providing antioxidant protection. It helps reduce inflammatory cytokines, protecting blood vessels and internal organs from damage caused by chronic inflammation. Balancing calcium. Maintaining calcium balance is not only important for bones but also helps improve nerve and kidney function. In diabetes treatment, supplementing with vitamin D appropriately is an important adjunctive strategy. Significant improvements in blood sugar control and reduced complications have been observed when patients adhere to this supplementation regimen. Vitamin D-rich foods and effective supplementation. To ensure the body receives enough vitamin D, you should combine natural foods and supplements. Natural food sources. Cod liver oil. Each tablespoon provides up to 340% of the daily requirement. Wild-caught salmon. A 100 grams serving provides about 130% of the daily requirement. Sardines. Approximately 110% of the daily requirement per 100 grams. Egg yolks and sun-dried mushrooms, although less, they still contribute to vitamin D intake in the daily diet. High-end culinary options. Japanese salmon with miso sauce and pan-fried cod liver with garlic butter not only provide a unique culinary experience but also are rich sources of vitamin D. Supplements. Products like Nordic Naturals Vitamin D3, 1000 to 5000 IU, capsule, and Thorne Research Vitamin D plus K2, combining vitamin D with K2 to support calcium absorption, are highly regarded for their purity and effectiveness. Foods to avoid to optimize vitamin D absorption. Refined vegetable oils, such as soybean oil and corn oil, can cause inflammation and hinder absorption. Refined sugar and alcohol. These not only negatively impact absorption but can also increase inflammation. Whole grains containing phytates. Phytates can bind to calcium and vitamin D, reducing their absorption. In the current environment, where many people lead sedentary lives and have limited sun exposure, vitamin D supplementation is more crucial than ever for diabetes patients. Regular blood vitamin D level checks and consultation with experts are necessary to adjust supplementation appropriately. Improving treatment effectiveness and quality of life. Maintaining adequate vitamin D levels not only supports blood sugar control but also protects vital organs like the nervous system, cardiovascular system, and kidneys comprehensively. With current evidence and research, I recommend that every diabetes patient consider this an essential part of their health management strategy. Vitamin B12 is an essential nutrient that plays a vital role in maintaining nerve health, producing red blood cells, and synthesizing DNA. For diabetes patients, especially those using metformin long-term, the risk of B12 deficiency is very high. Why are diabetics prone to vitamin B12 deficiency? Effects of metformin. Many studies have shown that metformin, a common medication for controlling blood sugar, can reduce vitamin B12 absorption by affecting B12 transport in the small intestine. A study in the Journal of Clinical Endocrinology and Metabolism showed that 30 to 40% of diabetes patients using metformin are B12 deficient after 4 years of treatment. Damage to the stomach lining due to high blood sugar. When blood sugar is high, the digestive system, especially the stomach lining, can be damaged, reducing the ability to absorb vitamin B12 from food. Age and reduced stomach acid. In older adults, the stomach produces less acid, reducing the ability to separate vitamin B12 from protein in food, leading to deficiency. In clinical practice, I've noticed that many diabetes patients are unaware of their B12 deficiency until they experience serious nerve or anemia problems. Regular testing and proper B12 supplementation can help prevent many dangerous complications. Signs of vitamin B12 deficiency. Vitamin B12 deficiency can cause many symptoms affecting the nervous system, cardiovascular system, and reproductive ability. Nervous system disorders. Patients may experience numbness in the extremities, loss of sensation, and nerve pain due to myelin, nerve protecting layer, damage. Macrocytic anemia. Vitamin B12 is necessary for red blood cell production. Deficiency can lead to fatigue, dizziness, shortness of breath, and pale skin. Cognitive impairment. Many mistake symptoms like confusion, memory loss, and brain fog for signs of aging, but they can be the result of prolonged B12 deficiency. Impact on reproduction. Men may experience reduced sperm quality, while women may experience ovulation disorders. Kidney damage and poor vision. B12 deficiency can increase homocysteine levels, a risk factor for blood vessel inflammation, cardiovascular disease, and kidney damage. A study in the journal Neurology indicated that B12 deficiency doubles the risk of Alzheimer's disease in older adults, showing the importance of maintaining optimal B12 levels. What role does vitamin B12 play for diabetes patients? Protecting the nervous system. B12 supports myelin regeneration, helping reduce nerve pain from diabetes and preventing peripheral neuropathy, reducing the risk of cardiovascular disease. Vitamin B12 helps lower homocysteine levels, one of the agents that causes inflammation and blood vessel damage, creating energy and maintaining red blood cell function. B12 is necessary for ATP, cellular energy production, and maintaining healthy red blood cell function. Preventing anemia. Vitamin B12-rich foods. To ensure the body receives enough B12, diabetes patients should prioritize foods rich in B12 such as Beef liver contains extremely high levels of vitamin B12, providing 3,500% of the daily requirement in just a small serving. Clams, one of the best sources, with 4,000% of the daily B12 requirement per serving. Sardines. Besides being rich in omega-3, sardines also contain 350% of the daily B12 requirement. Salmon supplements about 200% of the vitamin B12 requirement in each 100 grams. Eggs. Although lower in content, eggs are still a useful supplement with about 25% of the daily requirement. Suggested nutritious dishes. Foie gras with truffle sauce. A high-end dish that is not only delicious but also extremely rich in vitamin B12. Sea urchin sashimi, uni sushi, an excellent natural source of B12. Lobster thermidor. The combination of lobster and cream sauce makes for a luxurious and nutritious dish. Proper vitamin B12 supplementation. If supplementation from food is insufficient or patients have absorption problems, supplements can be used. Jarrow Formula's methyl B12, 5000 mcg, tablet, sublingual form helps absorption better. Especially suitable for people with stomach problems. Thorne Research methylcobalamin, 1000 mcg, tablet, biologically active form of B12. Supports nerve health and energy. Foods to avoid to optimize B12 absorption. Alcohol impairs liver function, hinders B12 metabolism. Refined grains and refined sugar cause inflammation and affect B12 absorption. Acid-reducing medications. People using proton pump inhibitors, PPIs, or H2 antihistamines are at risk of severe B12 absorption reduction. I often encourage patients to check their blood vitamin B12 levels regularly, especially those taking metformin or with neurological symptoms. Early detection and timely supplementation can help prevent many unnecessary complications. Vitamin B12 is not only necessary for overall health but also plays an important role in protecting the nervous system, preventing cardiovascular disease, and improving energy in diabetes patients. To maintain optimal B12 levels, you need to combine a diet rich in B12 with supplements if needed. Don't let B12 deficiency become a silent killer, causing dangerous health complications. Folate, also known as vitamin B9, is a vital nutrient in DNA synthesis, cell regeneration, and maintaining nervous system health. For diabetes patients, folate deficiency not only affects energy and memory but also increases the risk of cardiovascular, kidney, and nerve complications. Why are diabetics prone to folate deficiency? Diabetes patients are at higher risk of folate deficiency than normal people due to many factors. Chronic inflammation reduces folate metabolism. Prolonged high blood sugar causes chronic inflammation, affecting the enzymes involved in folate metabolism in the body. Metformin reduces folate absorption. A study in the Journal of Diabetes and Metabolism shows that metformin can reduce blood folate levels by up to 20 to 30%. Especially in people using the drug long-term. Frequent urination leads to folate loss through urine. Diabetes patients often experience frequent urination due to high blood sugar, leading to the loss of important micronutrients, including folate. I often see diabetes patients with folate deficiency who are unaware of it. Only when symptoms such as fatigue, memory impairment, or anemia appear do they realize the importance of this micronutrient. Checking folate levels and supplementing properly will significantly improve overall health. Signs of folate deficiency. Folate deficiency can cause many symptoms affecting health and quality of life. Fatigue, muscle weakness, slow wound healing, because folate is involved in energy production and cell regeneration. Brain fog, memory impairment. Patients often feel distracted, forgetful, easily confused with signs of aging. Macrocytic anemia. This is a condition in which red blood cells develop abnormally due to folate deficiency, causing pale skin, dizziness, and shortness of breath. Impact on reproduction. Folate is very important in the development of egg and sperm cells. Deficiency can reduce egg and sperm quality and increase the risk of miscarriage in women. Increased risk of cardiovascular, kidney, and eye diseases. Folate deficiency can increase homocysteine levels, an amino acid associated with the risk of stroke, heart failure, and kidney disease. According to a study in the American Journal of Clinical Nutrition, people with low folate levels have a 32% higher risk of cardiovascular disease than those with normal folate levels. This shows that folate is not only important for diabetes patients but also helps prevent many dangerous complications. Benefits of folate for diabetes patients: cell regeneration and DNA synthesis. Folate is necessary to maintain healthy cell division, especially red blood cells and nerve cells. Improves insulin sensitivity. Stabilizes blood sugar. A study in diabetes care shows that folate supplementation helps improve insulin sensitivity and reduces the risk of insulin resistance. Protects blood vessels. Reduces blood pressure. Anti-inflammatory. Folate helps reduce homocysteine levels in the blood, thereby protecting the cardiovascular system, reducing the risk of high blood pressure and preventing chronic inflammatory responses. I often advise diabetes patients to include folate in their diet to support cardiovascular function and stabilize blood sugar. This is a simple but effective strategy to improve overall health. Folate-rich foods. To ensure adequate folate intake, diabetes patients should supplement with the following foods. Beef liver, one of the richest sources of folate, providing 140% of the daily requirement. Spinach contains about 65% of the daily folate requirement, while also being rich in fiber and antioxidants. Lentils, an excellent plant source of folate, providing 90% of the daily requirement. Asparagus, in addition to folate, asparagus also contains many prebiotics that help support gut health. Avocado, besides folate content, 25% of the daily requirement. Avocado also provides healthy fats that help improve insulin sensitivity. Suggested nutritious dishes. French duck liver with truffle sauce, a rich dish, rich in folate and vitamin B12. Asparagus mushroom truffle risotto, not only delicious but also rich in folate and antioxidants. Black cod with miso sauce and edamame beans, combines high-quality protein with folate from edamame beans, creating a nutritious dish. If the diet does not provide enough folate or patients have difficulty absorbing it, supplements can be considered. Thorne Research 5-MTHF, 1000 mcg, capsule. This is the 5-MTHF, methylfolate, form, the biologically active form of folate, helping to absorb better, especially in people with the MTHFR gene mutation. Pure encapsulation folate, 800 mcg, capsule, a safe and effective option to supplement folate daily. Foods to avoid to optimize folate absorption. Refined grains, contains many phytates, which can hinder folate absorption. Alcohol, affects folate metabolism in the liver, increasing the risk of deficiency. Refined sugar, causes inflammation and can reduce the effectiveness of folate in protecting the cardiovascular system. Acid-reducing medications. People using antacids for a long time are at risk of poor absorption of folate and vitamin B12. Metformin. If you are using metformin, patients should check their folate levels regularly and supplement when necessary. Folate is not only important in maintaining overall health but also plays an essential role in cell regeneration, protecting blood vessels and improving insulin sensitivity. Diabetes patients need to pay special attention to their folate levels, as deficiency can lead to fatigue, memory impairment, anemia, and an increased risk of cardiovascular disease. To maintain optimal folate levels, you should combine a diet rich in folate with supplements if necessary. Don't let folate deficiency become a barrier to controlling diabetes and protecting long-term health. Vitamin C is not only famous for its role in boosting immunity but is also an important nutrient that helps stabilize blood sugar, protect blood vessels, and reduce chronic inflammation. For diabetes patients, getting enough vitamin C can help control the disease better and prevent many dangerous complications. Benefits of vitamin C for diabetes patients. Improves insulin sensitivity. Supports blood sugar control. A study in diabetes, obesity and metabolism shows that supplementing 500 mg of vitamin C twice daily helps reduce post-meal blood sugar by 36% in type 2 diabetes patients. Vitamin C works by reducing oxidative stress in cells. thereby improving insulin sensitivity and helping glucose be used more effectively. Protects blood vessels from damage caused by high blood sugar. Prolonged high blood sugar can damage blood vessel walls, leading to the risk of atherosclerosis, high blood pressure and cardiovascular disease. Vitamin C is a powerful antioxidant, which helps neutralize free radicals, thereby protecting blood vessels and preventing cardiovascular complications. Reduces inflammation, prevents diabetes complications. Chronic inflammation is the main cause of nerve complications. Kidney failure. Diabetic retinopathy. A study in the Journal of Clinical Endocrinology and Metabolism shows that vitamin C helps reduce inflammatory markers such as CRP, C-reactive protein, and Illinois 6, thereby limiting damage caused by chronic inflammation. Strengthens the immune system, prevents infection. Diabetes patients are at high risk of infection due to a weakened immune system. Vitamin C helps stimulate the production of white blood cells, enhancing the ability to fight bacteria and viruses. Many studies show that vitamin C deficiency can increase the risk of infection, slow wound healing, and even prolong recovery time after surgery. I often meet diabetes patients who complain about slow wound healing, frequent colds and prolonged fatigue. Upon examination, most of them have low vitamin C levels. After supplementing with vitamin C properly, they feel healthier, wounds heal faster, and blood sugar is more stable. Vitamin C should be supplemented through natural foods, which is the best way to absorb the maximum benefits of this micronutrient. Here are some vitamin C-rich foods that diabetes patients should supplement. Red bell peppers, 100 grams, provides 150% of the daily vitamin C requirement, while also containing a lot of beta-carotene to help protect the eyes. Kiwi, one fruit, meets 80% of the daily requirement, while also being rich in fiber to help reduce sugar absorption into the blood. Orange, one fruit, contains 90% of the daily requirement. Provides flavonoids that help reduce inflammation and protect the cardiovascular system. Strawberries, 100 grams, meets 60% of the daily requirement, while also containing anthocyanins that help increase insulin sensitivity. Broccoli, 100 g cooked, provides 70% of the daily requirement. Rich in sulforaphane, which helps reduce oxidative stress and protect blood vessels. Suggested nutritious dishes: smoked salmon salad with kiwi and chestnuts, rich in vitamin C, omega-3 and antioxidants to help protect the cardiovascular system. Stir-fried broccoli with garlic and red bell peppers. A simple dish but very effective in boosting the immune system. Things to note when supplementing with vitamin C. Diabetes patients need more vitamin C than normal. High blood sugar can compete with vitamin C in the process of absorption into cells, causing vitamin C levels in the blood to drop significantly. A study in the American Journal of Clinical Nutrition shows that people with diabetes have 30% lower vitamin C levels than normal people, even if they consume the same amount of vitamin C. Limit processed foods. Many processed foods contain preservatives, refined sugar and chemicals that can destroy vitamin C. Prioritize fresh foods, especially whole vegetables and fruits. Vitamin C should not be supplemented in excess. The recommended daily dose is 75 to 90 milligrams for normal people, but diabetes patients may need about 200 to 500 milligrams per day. Overdosing on vitamin C, over 2,000 milligrams per day, can cause kidney stones, digestive disorders and affect the absorption of other micronutrients such as copper and zinc. Vitamin C not only helps improve insulin sensitivity and stabilize blood sugar but is also an essential nutrient that helps protect blood vessels, reduce inflammation and strengthen immunity. Diabetes patients should focus on supplementing vitamin C-rich foods such as bell peppers, kiwi, oranges, strawberries, broccoli and limiting processed foods. If necessary, supplements can be used in appropriate doses to ensure adequate daily vitamin C needs. Think of vitamin C as an important part of your daily diet. With just a few small changes in your diet, you can significantly improve your health and prevent diabetes complications. Vitamin E is known as one of the most powerful antioxidants, playing an important role in protecting cells from damage caused by high blood sugar. reducing inflammation and preventing diabetes complications. For diabetes patients, getting enough vitamin E not only helps improve insulin sensitivity but also protects the nervous and cardiovascular systems, two organs most susceptible to damage when blood sugar is not well controlled. Benefits of vitamin E for diabetes patients. Powerful antioxidant. Protects cells from damage. People with diabetes often have high levels of oxidative stress, causing cells to be damaged quickly and accelerating the aging process. Vitamin E helps neutralize free radicals, protecting cell membranes from oxidation and minimizing the risk of complications caused by high blood sugar. Improves insulin sensitivity. Supports blood sugar control. A study in American Journal of Clinical Nutrition shows that supplementing vitamin E can help reduce insulin resistance, helping the body use insulin more effectively and thereby better control blood sugar. In addition, vitamin E also helps reduce chronic inflammation, an important factor in the development of type 2 diabetes. Protects the nervous system. Reduces numbness and pain. Nerve complications due to diabetes, neuropathy, is one of the most serious consequences, causing numbness, pain, and loss of sensation in the hands and feet. Vitamin E protects nerve cell membranes, reduces inflammation and supports nerve regeneration, helping reduce numbness symptoms and improve nerve function. A study in diabetes care shows that supplementing vitamin E helps reduce peripheral nerve pain and enhances the recovery ability of nerves. Protects the cardiovascular system. Reduces the risk of atherosclerosis. Diabetes patients have a 2 to 4 times higher risk of heart disease than normal people because high blood sugar damages blood vessels. Vitamin E helps prevent LDL cholesterol oxidation, thereby reducing the risk of atherosclerosis and cardiovascular disease. A study from Harvard School of Public Health shows that people who supplement vitamin E adequately have a 20% lower risk of heart disease. I have met many diabetes patients who complain about prolonged numbness in their hands and feet and nerve pain, especially those who have been using metformin for a long time. When tested, they often have low vitamin E levels. After supplementing vitamin E along with other antioxidants such as vitamin C, they felt a significant reduction in numbness and pain. This shows that vitamin E is not only beneficial but also very necessary for people with diabetes. Vitamin E-rich foods. Supplementing vitamin E from natural foods helps the body absorb it better without worrying about side effects. Here are vitamin E-rich foods that people with diabetes should include in their diet. Almonds, 28 g, about 23 seeds, provides 50% of the daily requirement. Rich in healthy fats to help protect the cardiovascular system. Sunflower seeds, 28 g, provides 45% of the daily requirement. Contains zinc and selenium to help boost immunity. Extra virgin olive oil, 1 tablespoon, provides 30% of the daily requirement. Rich in polyphenols that help fight inflammation. Avocado, 1 fruit, provides 20% of the daily requirement. Contains a lot of potassium to help stabilize blood pressure. Spinach, 100 g cooked, provides 25% of the daily requirement. Contains iron and folate. Good for the circulatory system. Suggested nutritious dishes. Avocado. Almond and olive oil salad. Helps absorb vitamin E effectively, while also being good for cardiovascular health. Grilled salmon with sunflower seeds. Provides omega-3 and vitamin E to help protect blood vessels. Things to note when supplementing with vitamin E. Avoid refined vegetable oils. Soybean oil, corn oil and other refined vegetable oils can destroy vitamin E in the body. Instead, use extra virgin olive oil or flaxseed oil to preserve the benefits of vitamin E. Combine with vitamin C to increase antioxidant effectiveness. Vitamin C and vitamin E have a synergistic effect, helping to increase antioxidant capacity and protect cells from damage caused by high blood sugar. A study from the Journal of Nutrition shows that supplementing both of these vitamins helps reduce inflammation and improve insulin sensitivity better than using them alone. Vitamin E should not be supplemented in excess. The recommended dose is 15 mg per day. But if supplementing from supplements, do not exceed 400 IU per day because it can increase the risk of bleeding. If you are using blood-thinning medications, such as aspirin or warfarin, consult your doctor before supplementing with vitamin E. Vitamin E is an important antioxidant that helps protect cells, improve insulin sensitivity, protect the nervous system, and reduce the risk of cardiovascular disease in diabetes patients. Diabetes patients should supplement vitamin E from natural food sources such as almonds, sunflower seeds, olive oil, avocados, and spinach. In addition, combining vitamin E with vitamin C will help increase antioxidant effectiveness and better control blood sugar. If you are experiencing problems such as numbness, nerve pain, or are at risk of cardiovascular disease, consider supplementing vitamin E reasonably. With just small changes in your diet, you can protect your health more comprehensively. Through this article, we have learned about the important role of vitamins D, B12, B9, folate, C and E for people with diabetes. These micronutrients not only help improve insulin sensitivity and support blood sugar control but also protect the nervous system, cardiovascular system and immune system from dangerous complications. A balanced diet, combined with a healthy lifestyle, can help you control diabetes naturally and sustainably. Remember that. Check for micronutrient deficiencies if you are experiencing signs such as fatigue, numbness, memory loss, nerve pain or weakened immunity. Testing for vitamins D, B12, and folate will help you have timely supplementation options. Prioritize supplementation through natural foods such as salmon, eggs, animal liver, green vegetables, almonds, avocados, to ensure the body absorbs optimally without worrying about side effects. If necessary, you can supplement with supplements in reasonable doses according to expert advice. Eliminate harmful foods such as refined sugar, alcohol, refined vegetable oils and processed foods, factors that reduce vitamin absorption and make diabetes worse. Build a healthy lifestyle, maintain a regular exercise habit. Expose yourself to sunlight and get enough sleep so that the body absorbs and metabolizes vitamins better. Light bulb. If you find this content useful, please like and share so more people know about it. Push pin if this is your first time visiting Health and Life. Don't forget to click subscribe and turn on notifications so you don't miss out on useful videos about health, nutrition and how to control diabetes effectively. Speech balloon. If you have any questions or experiences about vitamin supplementation for people with diabetes, leave a comment below. I will always read and respond to help you get the most accurate information. Please pay attention, listen and apply the doctor's advice so that we can improve your condition and make changes in your condition to recover as quickly as possible. Thank you for watching. See you in the next videos of Health and Life. Heart.